Thanks again for tuning into the Foot and Ankle Orthopedic Surgeon. Today we're going to talk about Lisfranc ligament injuries and when you might be able to return to sport. Just to recap, a Lisfranc ligament injury occurs at the ligament that runs between a bone known as the medial cuneiform, marked there, and a bone called the second metatarsal, which are two major bones in your foot. And this injury can cause a lot of long-term problems with your foot if missed, such as arch collapse, osteoarthritis, or ongoing pain. Now, one of the ways this injury can present is this little type of chip fracture, which occurs off usually the second metatarsal, and it's just marked out there with the arrow. Often a part of the ligament will be attached to that piece, meaning that that whole complex there is unstable, and unless that is treated, it's likely to cause you some long-term issues with the foot. The other way the injury can present is a purely ligamentous injury, so purely soft tissue injury, no fracture. And that means the ligament itself is actually ruptured, as is marked out in the diagram there by the red lines. And so this can be quite a sinister injury. And as a result, you wonder what's going to happen with the return to sport. So the information we have in today's episode is based on this article that was published in the Journal of ISAKOS. And it's what's known as a meta-analysis. Now, if you want to access the article, you just need to use that QR code in that right corner, and that'll take you to the full text. But it's quite interesting in terms of the results, although the article has some limitations. Now, it was a meta-analysis of studies between 1995 and 2020, so in the end they managed to have 15 studies as per their inclusion criteria, and they mainly looked at the return to any level of sports or returned to the pre-injury level of sports, and they broke this up into three groups, one being conservative management, usually trialled in a boot without weight bearing for at least 6 weeks. I imagine those injuries were far less severe. The second group was what's called surgical fixation, which is pretty typical for Lisfranc injuries, where patients had plates and screws, sometimes wires, to hold everything in place, and often they would need to come out at a later date. And then the third group had what's called a partial arthrodesis or fusion group, meaning that a couple of the bones in the foot were melded together with plates and screws in order to mean that those bones no longer move anymore. And often the areas where that occurs is where those three arrows are pointing there on the right. And just to give you a better idea of that as to what bones are typically fused in what's called a partial arthrodesis, we marked out the first bone that's often fused, which is called the middle cuneiform, marked in green there. And you can see, if you look at the diagram on the right, that's been merged with the bone above it called the second metatarsal. The other bone that's often merged is the medial cuneiform, marked in yellow just there, and that's usually merged with the bone just above it called the first metatarsal. And then the third bone that's usually melded is the lateral cuneiform, marked in orange there, which is melded with the third metatarsal above it. And so you have these three groups, and what they looked at was the rate of return to sport in each of those three groups. Now, the first one they looked at was return to sport at any level, and they were pretty similar between the groups. Conservative group was about 93%, surgical fixation group was 94%, as was the partial fusion group. When they then looked to returning to sport at pre-injury level, which is really important, all of those numbers dropped. So down to 88% in the conservative, 86% in the surgical fixation group, and 75% in the partial fusion group. And that would make you think, well, partial fusion group is really bad operation, but in fact, probably they were getting that operation because they were the more severe injuries. And so there's a level of bias and confounding to that finding. So take that with a little bit of grain of salt, but nonetheless, it's more difficult to return to your pre-injury level. Then we're looking at average time taken to return to sport. That's a range between all three groups, somewhere between 7 and 33 weeks, so a fairly long time, and that'd be typical of what my experience is. Now, there were some limitations to the study. They didn't adjust for injury severity, and that will have a big factor on terms of when you return to sport, because a soft tissue injury will be huge if it's more severe. They basically said there were a large number of studies with low methodological quality. What that means is that most of the studies were not very good that were included in the analysis, and there was a large amount of underreporting in terms of return to sport time and rates in a number of the studies. So nonetheless, it's a useful study giving us some guide to say that Lisfranc injuries is going to take you a long time to return. There's a number of limitations with the study, but I hope you have enjoyed today's episode. It gives you some guide of when you might be able to make it back after a Lisfranc injury, and the fact that there's some people that don't get back to their pre-injury level. If you enjoyed our talk today, please take a look at the Foot and Ankle Orthopedic Surgeon and subscribe, or take a look at one of our other videos here. Thank you, as always, for listening.